Is Covered California killing small group health insurance plans? For some employers, it is, because the subsidies offered through Covered California are better than what the employer can offer through a small group plan. And so many families of low and moderate income are better off in Covered California than with a employer small group plan. Small group plans are 2 to 100 employees, and generally most of the folks that I have dealt with are 20 to 30 employees. And if they have low to moderate income wage earners, Covered California, because of the American Rescue Plan and the higher subsidies, makes a lower cost for their overall health insurance premiums. When Covered California came into existence, the individual and family rates were much higher than the small group rates. Over time, the individual and family rates in California, the increase has not been as great, and some of the carriers have actually reduced their rates, bringing them closer to the small group rates. But early on, with the lower small group rates and the employer contribution, people were still better off in the small group plan. I took a look at some bronze plans for 2021, small group versus Covered California for an individual age 40 in 3 different regions: Sacramento, San Francisco, and Los Angeles. And we can see that the Kaiser plans are still a little bit higher for the individuals and families in Sacramento and San Francisco, and a little bit lower in Los Angeles. Then moving to the Blue Shield Ppo, which tends to be a higher cost plan than the moderately priced Kaiser HMO. In Sacramento, the individual and family plan rate is a little bit higher by 7%, but in San Francisco, pretty much even at 1.8% lower, and in Los Angeles, it's lower by 10%. So that rate differential for many plans doesn't necessarily exist when we compare comparable plans, because the carriers offer many different small group plans with lower rates, but sometimes the benefits can be a little bit different. But a silver plan should be pretty much the same actuarially. But so I have been getting a lot of questions from small employers about, is this making any sense for my employees? Because the costs are really high. Some of the employees are complaining that they're in a bronze high deductible health plan, and then when they go to a doctor, nothing's covered, but they're in that least expensive plan because they're not making a whole lot of money, maybe $40,000 a year, trying to support a family, and nothing is getting covered, and they're having to pay a lot for it. Now, in a small group plan, generally the employer is making a contribution of 50% to the employee-only rate. So if you have a household of 3, with the employee being one of the adults, that person's health insurance is reduced by 50% because of the employer contribution, but there is generally no contribution made by the employer to the spouse or the children. And so they're paying the full rate, and so it gets really expensive really quickly. So is it better to go with Covered California and just scrap the small group plan altogether? For some employees, it may be better. But what I did is I kind of looked at a theoretical or hypothetical family, 2 adults and 1 child. Both the adults are age 40, and the child is at 10 years old. And then I went to the rate sheets for both the Blue Shield Ppo and the Kaiser HMO in those 3 regions, Sacramento, San Francisco, and Los Angeles, and looked at the rates for a silver plan that was comparable to the Covered California Silver 70. I went to the Covered California Shop and Compare tool and put in that family using an income of the median household income listed most recently by the U.S. Census Bureau. And so I used that to determine what the subsidy would be. And of course, one of the adults in the small group plan that contribution was 50% of the rate for that 40-year-old individual. So in Los Angeles, median income $69,000. This household family of 3 was eligible for a covered California subsidy of $544, but only an employer contribution of $263. So even though the rates for the Silver plan, Silver 70, and the small employer group, Blue Shield Ppo 2250, it's 2250-55 with the Kaiser, are comparable, the higher subsidy lowered the health insurance cost to the point where if you were enrolled in a Blue Shield Silver plan, that family would be paying $307 more and $368 more for the Kaiser. And we do have to remember that the covered California plans, the silver plans, are artificially inflated 10 to 15%. But of course, the subsidy keys off the silver plans, so it kind of works itself out. But they are a little bit higher if you're paying just for a straight covered California plan, a Silver 70 plan. Next, I went to Sacramento County. The median household income is $68,000. The subsidy for the family is $901.40, and that can be applied to any metal tier and any carrier, Blue Shield, Kaiser, Molina, HealthNet, Chinese Community Health Plan. It doesn't make a difference. The subsidy is a subsidy. And in Sacramento, if the family was to choose that Blue Shield Silver small group plan, they'd pay $348 more than if they were in covered California. And surprisingly, if they chose the Kaiser Silver, they'd be paying $478 more over covered California. So next, looking at San Francisco, the median income is much higher at $113,000. But the difference still persists in terms of covered California being less expensive than the small group plans. Now, one thing to consider is if both of the adults were in a small group plan and both of them had access to that employer contribution, of course, both ages being 40, that would be $311, and then the overall net cost for the family would be less if both adults had access to that employer contribution for that silver plan. However, that would be the case in San Francisco, but it wouldn't be the case in Los Angeles or Sacramento, where that smaller employer contribution still didn't make up the difference between the subsidy of covered California and the employer contribution in the small group plans. But one of the things this does tell us is that high wage earners are better off with the small group plans because the employer contribution is not dependent on their income, but the subsidies are. So as the income goes up, the subsidy goes down. And so, higher wage earners, usually the owners of the company are better off with a small group plan, but the lower wage earners, the production people, the service workers, they're put at a disadvantage. Another thing to remember is that if an employee or an adult in a household is offered employer group coverage that's considered affordable, the spouse and the dependents can't get covered California. And there's only one exchange, I believe it's the Covered California Small Business Exchange, where you can have an offer insurance just to the employees and not to the spouse and dependents, and they can go to Covered California. But most small group plans aren't like that. So if you're in a group plan, then generally the spouse and dependents are cut out of Covered California, and that is one of the things that puts them at a disadvantage. The other little weird, pernicious thing that is set up in these small group plans, and we have to remember that the ACA was written to protect group health insurance plans. In a small group plan, the employer can choose the benchmark plan for that contribution at a bronze plan. So if the family wants a silver plan, they're only going to get a contribution based on the cost of the bronze plan, which will be less expensive. So that further increases the overall net cost of the health insurance for the employee's family. And that's one of the nice things about Covered California. It's much more flexible. So, of course, the subsidy is the subsidy, but each member of the family can have a different metal tier plan and a different carrier. So one person could be in a Kaiser Bronze, another person could be in a Blue Shield PPO Silver, and then maybe someone else might have a Chinese Community Health Plan Gold. And the subsidy for that age would follow them to reduce that amount. But that's one way you can actually further reduce the overall net cost, and it makes it even a better situation compared to the small group plans where everyone in the family must be in the selected plan for the employee. So everyone's locked into that silver or bronze plan, even if they may need a different metal tier plan because they have other issues, they have prescription drug needs. And so the small group plans limit the flexibility to address the different health concerns of family members. So in general, right now, as it stands, Covered California is a better deal for many employees in small groups. Again, family situations are different, they vary, all the employees are different, so it's hard to make big sweeping generalizations. But for many low and moderate wage employees, Covered California is a better deal. Well, if you have any questions or comments, you can leave them below. You can give me a call. Go to my website. I have more information on this particular topic on the blog post, Is Covered California Killing Small Group Plans? I'm Kevin Knaus for InsureMeKevin.com. Thank you so much for watching.